welcome back to our Mental Health Monday series. Today I'm going to be talking about the different types of providers that can help people, because there's a real confusion kind of across the board about where to go and who to turn to when you're dealing with various mental health issues. So today I'm going to try and clarify some of that to go ahead and give some of that initial guidance to people that they may be a little apprehensive about seeking out on their own. So let's start with the bachelor's level. Those with a bachelor's in psychology, behavioral health, counseling, things of that nature in the state of Illinois can be qualified to become mental health professionals. So that's kind of the first level, the first tier that we see when it comes to the field. So behavioral health professionals that are at this level typically work in community mental health centers and things of that nature, kind of assisting the counselors with doing different elements of what they do, such as the intakes and working on the different needs of the person behind the scenes in addition to their mental health. So again, in the state of Illinois, a bachelor's degree in the field means that you are qualified as a mental health professional. Now, our next level that we have is for those who obtain a master's degree. So in the state of Illinois, once you have obtained that master's degree and you've done your practicum internship hours, you are considered a qualified mental health professional. Now, qualified mental health professionals can and will provide therapy for different people. You often find the QMHPs in community mental health centers. These are the people that are usually working toward licensure and have already completed, again, their master's degree and the internship hours and had that initial experience. Next, we're going to talk about the first level of licensure. So in the state of Illinois, you have LPCs, which are licensed professional counselors, and you have LSWs. Those are licensed social workers. So these are the individuals who have already completed their master's degree, they have fully completed their internships, their practicums, and they have also studied for and passed their first level of examination. So these are people who are licensed and they are under supervision. These are the ones that work in counseling centers, private practices, and things of that nature, and again are qualified to do psychotherapy. If you are an LPC or an LSW, you do have to have a supervisor over you at all times until you reach that next level of licensure. So what is that next level? In the state of Illinois, you go from an LPC to an LCPC. You go from an LSW to an LCSW. These are clinical licenses. These are the people that have already been licensed under supervision for anywhere from a minimum of 2 years up to however many years it took for them to go ahead and take that next level of examination. So when you get your clinical license, you have to have completed in the state of Illinois a minimum of 2 years under supervision. Then you can sit for the clinical exam to become clinically licensed. Once you are clinically licensed, you no longer require supervision as you work with clients. LCPCs, LCSWs do psychotherapy, they work with clients, and they also provide supervision to those LPCs and LSWs that are coming in behind them. Now, what's the difference between a psychotherapist, a psychologist, and a psychiatrist? So, psychotherapists are typically the LPCs, the LSWs, the LCPCs, and the LCSWs. These are the ones who are providing counseling, marriage and family therapy, trauma therapy, working with people on anxiety. This is the relationship couples therapists. These are all psychotherapies. So this is where you come in and you talk with the professional and you set the different goals, and there is no medication included. None of these people that I've previously mentioned can write prescriptions for medication. They can send you a referral to go to your medical doctor or to a psychiatrist, but they themselves cannot prescribe medication. Now, psychiatrists can prescribe medication, but so can another group of people. They are called psychiatric mental health nurse practitioners. We're seeing a huge rise in this profession over the last few years, and this is to kind of assist all the psychiatrists who are becoming overwhelmed with the medication management. So these nurses have the ability to prescribe medication. They can do the same intake assessments that psychiatrists can do. They can look for all the same symptoms and signs, and then they can move forward and they can prescribe the medication and do the follow-up check-ins with the patient. Now, where can you get services? This is a really tough one for a lot of people because initially when you go to find help the first time, you often are told that there's a waiting list. But there are different places that you can find help. So, reaching out to colleges or universities that have the master's programs is a great place to start because that's where all the interns are going to be. And internships are done free of charge. And it's a really good opportunity for these people coming into the field to get that hands-on experience. So I always encourage, if you're looking for help and you're coming up short, to reach out to colleges or universities in your area that have these master's level programs that are prepping people for licensure, just to see if there's anybody there that can direct you. Another great place to go is community mental health centers. Now, when you go to community mental health centers, you will often see that they are mainly staffed with the QMHPs. So these are the people that are finishing up their master's degrees, finishing up their internships and practicums, and are in that space before they work towards licensure. Again, these are people that have completed their master's degrees, so they do have a good deal of background knowledge on how to work with patients and clients, but again, they are not yet licensed. The reason for this disparity is a couple different things. So community mental health centers often typically take Medicaid and Medicaid only. The Medicaid paid rate for psychotherapy versus private insurance is a huge gap. And so what ends up happening is these community mental health centers don't bring in that much money. And so as a result, their counselors and therapists do not make that much money either. And so this tends to be a real problem because we see these QMHPs working in these facilities, they do a good job, they get licensed, and then they leave because they can make 3 to 4 times more money somewhere else. So I do want to be very transparent about community mental health centers and their staffing and kind of how they operate and work. Now, if you're seeking a therapist, the best place for you to always start is Psychology Today. It's absolutely wonderful. You can go in and you can filter by your insurance type. You can filter by what issues you feel like it is that you're dealing with. And it really allows you to kind of take a look at the providers that are within whatever distance you choose to see if there's someone who may or may not be a good fit for you. I always recommend interviewing your therapists. You'll often find that they do provide 15-minute free consultations. Please take advantage of this and get to know the person that you could potentially be working with in the future. Therapy is very delicate and it's very personal, and so you want to make sure that your therapist is a good match for you. And one of the ways you can do this is, again, by interviewing more than one person, seeing who's a good fit for you, and then moving forward from there. Please don't feel like you have to take the first person that's available. You can do that if you feel like you're really struggling, but then don't put pressure on yourself to make them a perfect fit. Be yourself, be calm as you can be in this initial meeting. I know the first meeting with the therapist can be very anxiety-inducing, but if you just kind of take that breath and allow yourself to talk, you can really start to kind of evaluate if there's going to be that therapeutic connection. And that does really matter when you're seeing a provider. So again, just a reminder that if we are seeking medication for mental health issues, we have a couple of different options. You can go to a medical doctor, such as your primary care physician. You can go to a psychiatrist, or you can make an appointment with a psychiatric mental health nurse practitioner, and this is all within the state of Illinois. I know this all varies by state, and so again, this is just focused on the state of Illinois. So again, those are the different types of providers that we have. When you are looking for a therapist, it is very important that you know what kind of therapy you are seeking. We have marriage and family therapists, we have couples therapists, we have therapists that work mainly with children, we have therapists that work with older adults, and then we have therapists that kind of work on a larger scale. We also have therapists that specialize in different things, such as trauma work, those who specialize in mood and personality disorders, those who specialize in PTSD. There are several different options out there for you to look at when you are trying to find somebody. So again, I know it can be really overwhelming kind of initially trying to start, so hopefully I clarified today a little bit more about who's who and who does what to help with anyone right now who is struggling to find that provider. So again, just a brief recap. In the state of Illinois, bachelor's level is considered a mental health professional. Master's level with internship completed is a qualified mental health professional. You are licensed and then become a licensed professional counselor or a licensed social worker. After 2 years minimum under supervision, you can then take your test to become clinically licensed. At that point, you can provide therapy without having a supervisor. Hopefully that answered a lot of the questions you guys have been having around who does what, and I really hope you guys have a fantastic rest of your day, and don't forget, mental health matters.